A very good evening to all the delegates. Alembic welcomes all delegates to Converge. Converge is an e-learning platform for the physicians. It is an initiative taken from the makers of Recool and Netric. I would like to introduce our speaker for the day, Dr. Pralhad Manchekar. Dr. Pralhad Manchekar is an MBBS and DCH. Dr. Pralhad Manchekar is a senior consultant pediatrician with rich experience in the field of internal medicine and pediatrics. He has his clinical practice in Vengula and is also associated with Rural Hospital as a consultant physician. Dr. Pralhad Manchekar also has rich experience in teaching. He is associated with KES LADP Medical College as a visiting professor. He has served as a president at Indian Medical Association. With his skills and expertise, Dr. Pralhad Manchekar is devoted to serve humanity through various social service activities for the nation. Alembic welcomes our speaker for the day, Dr. Pralhad Manchekar. Our panelist for the day is Dr. S.V. Kulkarni. Dr. S.V. Kulkarni is an MBBS, MD Internal Medicine, and FICP. Dr. S.V. Kulkarni is a senior consultant physician in Khopoli, Raigad. He has a rich experience of over 35 plus years in the field of internal medicine. Dr. S.V. Kulkarni also has a rich experience in teaching. He has been a faculty of Miraj Medical College, D.Y. Patil Medical College and Hospital, and is now associated with ITM Healthcare in Navi Mumbai. He has served as organizing secretary of Epicon 2007 in Goa and is now a faculty member at Indian College of Physicians. With his skills and expertise, Dr. S.V. Kulkarni is devoted to serve humanity. Alembic welcomes our panelist for the day, Dr. S.V. Kulkarni. Our second panelist for the day, Dr. Gangaram T. Rane, is an MBBS, DNB Internal Medicine, and FCPS. Dr. Gangaram Rane is a consultant physician with rich experience in the field of internal medicine. His area of interest includes diabetes and cardiac diseases, diagnosis, as well as treatment. With his skills and expertise, Dr. Gangaram is devoted to serve the nation through various social service activities. Alembic welcomes our panelist for the day, Dr. Gangaram Rane.
Okay. I'm going to talk on the COVID-19 and management in diabetes patients. So this is my visiting card. काय काही वेळी करून जर वाढत गेला तर असं कार्ड छापायची पाळी येणार की whether or not you are immunocompetent, whether or not you are COVID positive. At the end of talk, I will see to it that the talk become interesting आणि आलियासारखं असं म्हणायची पाळी येणार नाही की मुझे घर जाना है. It's an infectious disease caused by recently found virus, coronavirus, and it was originated in Wuhan. I won't go into the details where was it originated because even the Singapore knows it, so I did not go into the details. Okay, हे कोरोना व्हायरसचे एक तीन भाऊ आहेत म्हणता येईल. SARS coronavirus was detected in China way back in 2002. Then the MERS, Middle East Respiratory Syndrome coronavirus, was the first case was reported in Saudi Arabia in 2012, and now in 2019 it is a novel coronavirus that has been detected. I will quickly go through what is the current situation in world and India. See, this graph looks better because as compared to the United States, we have less number of cases. See, here the India is seen. But what is the fact? The number of COVID tests that have been done per 1,000 people, Denmark is top on the list, whereas India is somewhere down. So we are not doing probably plenty of tests. That is true. This is the graph taken from the recent WHO site, and as these are the first lockdown, second, third, and fourth. After the third lockdown, even the tests have been increased, and number of positive. This red distinct line shows the number of positive cases, confirmed cases, and the blue line shows the number of tests that have been done. What is the condition in Maharashtra? See, Maharashtra, almost 49% are totally asymptomatic. 4% death have been observed and 3% cases are critical. Age-wise distribution, if you go, it is seen mainly in the young population, 20 to 40. I will go into details. Everybody knows it. See the mortality graph. Mortality increases as the age increases. Now, why this is so? Obviously, when the age increases, the plenty of comorbid illnesses are there, diabetes and so on. So also the pediatric population, see the mortality is very less negligible in 10 to 19 and almost nil in the range of 0 to 10. So this is because probably the children do not go outside. And one thing they have been postulated that there is a role of as this thing angiotensin converting enzyme 2 receptors. These receptors, they have found they are less in number in the alveoli or the pulmonary cells of the children, and or there is a less interplay between them, and that's the reason why the mortality is less. Of course, there are plenty of reasons for that. We won't go into the details of it. We'll see what is meant by suspect case, what is the probable case, what is a confirmed case, and what is close contact. Though everybody knows it, we'll have a sort of revision. So, whom to call it is a suspect case? One, a patient with acute respiratory illness, that means fever and at least one sign or symptom, cough or dry cough or shortness of breath, HFIC ache, and history of travel or residence in a location reporting community transmission. Suppose a patient comes to Sindhudurga from Bombay, especially Dharavi or Vashi, and he has a fever and cough, that he becomes a suspect case. Second, a patient with acute respiratory illness and having been in contact with the confirmed or probable COVID-19 case, he becomes a suspect case. And third is a SARI, severe acute respiratory illness. This is just like influenza-like illness with the higher severity. That means fever and at least fever, cough, shortness of breath, and requiring hospitalization. That means the patient is serious, and in the absence of the alternative diagnosis that fully explains the clinical presentation. That means if it is a bronchial asthma, known case of bronchial asthma with fever, cough, and the shortness of breath, this is not called, he will not be labeled as a SARI. Probable case is probably the one when the report comes as inconclusive or test could not be performed for one reason or the other. Or of course the confirmed case, I need not tell you when to call you. What is the definition of the contact? The contact is a person who experienced any one of the following exposures during the 2 days before and 14 days after the onset of symptoms of a probable or confirmed case. Whom to call it is a close contact. If the contact is less, rather more than 15 minutes, the distance between the infected person and the contact is more than 1 meter, and both of them are not wearing a mask, no mask, then it is called as a close contact. Coming to the symptomatology, lot of symptoms, but the fever is the main, followed by dry cough. Usually there is no productive cough, but you can get cough. There is no rule of watering of the nose, fatigue, shortness of the breath. This is very important because this is the beginning of the case is becoming a little bit critical. Then the sore throat, headache, chills, so on and so forth. Abdominal pain, diarrhea. I haven't included some symptoms like the loss of taste and smell sensation. But nowadays they have come to the conclusion that it is no way the characteristic feature of the COVID. You can get loss of taste sensation in any other viral diseases. हे सिम्टम किंवा ह्याच्यातलं एक जरी सिम्टम घेऊन जर पेशंट आला, इस्पेशली रेड झोन मधून किंवा कंटेनमेंट झोन मधून, तर तुमची कानात घंटी वाजली पाहिजे की कहीं वो ये तो नहीं. प्रत्येकाच्या मनात म्हणजे तरुणपणी अशी एक कोणतरी करीना असते. करीना दाखवायचा उद्देश की कोणी तुमच्याकडे जरी करीना आली तरी तो कोरोना तर नाही ना याचा विचार केला पाहिजे. प्रत्येक तरुणाच्या मनात अशी कही वो ये तो नाही आलेली असते. आम्ही तरुण असताना पहिल्यांदा हेमामालिनी, नंतर माधुरी दीक्षित यांनी बरीच वर्ष आमच्या मनावर अधिराज्य केले. आता तरुण माणसांच्या तरुण पिढीमध्ये त्यांची जागा पदुकोण, दीपिका पदुकोण आणि आलिया भट वगैरे घेतली. Every person coming with the contact, coming with the fever, cough is corona unless proved otherwise. Okay, this is the dictum. You have to take temperature of the every patient, look whether or not he is looking sick. If the patient is having fever and he is not looking sick, probably it is influenza. But if it's sick looking, more likely to be uh, COVID. Focus, look at the focus. If you can see the focus, that means the tonsils, then probably it's not corona. Tachypnea, measure the respiratory rate. More the respiratory rate, more the difficulty in breathing, you are likely to be in trouble. The role of negative predictors, uh, though the CRP and all these are not confirmatory tests for the corona, if the CRP is negative, it probably goes against the diagnosis of corona. जाने कहाँ गए वो दिन. आजकाल पेशंट कमी झाले, ओपीडीचे अवर्स कमी केले, 8 तासाहून 4 तास, 2 तास, तरी पण 50%, काही काही ठिकाणी त्याहूनही पेशंट कमी आले. असं म्हणायची पाळी आले. पण डोंट बी इम्पेशंट. हे दिवस जातील. मला कित्येकांचे फ्रँटिक कॉल्स येतात, कित्येक माझे कलिगचे, की पेशंट गेले ते पेशंट नाही. तर ऑब्विसली फॉर मेनी रिझन्स पेशंट लोक घरातलं खात आहेत, बाहेर फिरत नाहीत, मास्क वापरत आहेत, सगळी बाहेरची इन्फेक्शन कमी झालेत. त्यामुळे नथिंग टू वरी. इवन मोठ्या हॉस्पिटलमध्ये जी फुल असतात ओपीडी, तिथं पण हीच कंडिशन आहे. मागे एकदा एका वेबिनारमध्ये मी ऐकलं की अहमदाबादचं एक हॉस्पिटल होतं, अगदी लिडिंग हॉस्पिटल, तोबा गर्दी ओपीडी. त्याला विचारलं गेलं की हाऊ डू मॅनेज द सोशल डिस्टन्सिंग इन युअर ओपीडी ऑर इन द रिसेप्शन. तो म्हणलं सुदैवाने आता पेशंट इतकं कमी असतात की सोशल डिस्टन्सिंग पाळताना काही प्रॉब्लेम येत नाही. ओके, this is timeline of coronavirus. You see, mainly on the 8th day, there is a development of the shortness of the breath. And this is very important. This is beginning of the severity. What are the emergency warning signs? Difficulty in breathing, shortness of the breath, persistent pain or pressure in the chest, probably myocarditis, new confusion or inability to arouse encephalitis of brain involvement, and cyanosis. Are not, you know it very well. It is it shows how many people each infected person will in turn infect in a fully susceptible population. More are not more contagious. See, the measles are 15 are not. Smallpox 4.8 is not there. Leave aside. SARS 3. COVID is only 2.8. MERS is very less. Now, what about the mortality? We are worried about the COVID-19 mortality. Look at the MERS, 34% mortality. SARS, 10% mortality. Okay, so you should not worry about this. I won't go into the details. These are for the academic purposes. Uh, yes, coming to the common comorbid condition, hypertension, diabetes, coronary heart disease, cerebrovascular disease, some morbidities I haven't included. These are mainly the COPD, bronchial asthma, malignancy, nephrotic syndrome, pregnant ladies, patient taking steroids, so on and so forth. People with diabetes do face a higher chance of experiencing serious complications from COVID-19. These are the RSSI, RSSDI guidelines. People with diabetes are more likely to experience severe symptoms and complications when infected with virus. If diabetes is well managed, the risk of getting severely sick is about the same as general population. Having heart disease or other complication in addition to diabetes could worsen the chance of getting seriously ill from COVID-19. If glucose is poor, severity of the virus illness and the risk of complication will increase because of impairment of immunity. People with diabetes do face increased risk of DKA. It is mainly seen in the type 1 diabetic. There is no clarity between the COVID infection and difference in risk between type 1 and type 2. People who already have diabetes related health problems are likely to have worse outcomes than people with diabetes who are otherwise healthy, whichever type of diabetes they have. More important is that the people with either type of diabetes vary in their age, complication, and how well they have been managing their diabetes. Yes, when should a diabetologist suspect COVID-19? Not only diabetologist, any clinician. See, these are the differentiating factors. Corona, in case of coronavirus, incubation period is more. Symptom onset is gradual. Symptom lasts for more than 2 weeks. Then these are the common things. Fever is common. Then the cough is common, dry cough. Difficulty in breathing is common. Whereas running nose, sore throat, and the body ache are less common. Let's come to the prevention measures quickly. I want to give more time to our panelists so that the delegates can ask their queries and get these things clarified. Hand washing techniques, I won't go into the details. Everybody knows by now. This is William Osler, father of medicine. What he said years back, शेकडो वर्षापूर्वी तो सांगून गेला. Soap and water and common sense are best infectants. We are already using soap and water, but probably at times we are not using our common sense that one should use very often. Then there is no worry. These are the 5 moments when you have to do hand hygiene in case of admitted patient. One, before patient contact. Second, before doing any aseptic task. Third, after body fluid exposure, say for example, a blood checkup and all that. Then the after patient contact and after while leaving the after contact with the patient surrounding. So while examining one admitted patient, you have to do the hand hygiene 5 times. Coming to the social distancing, lot have been talk about this social distancing. It has in statistics show that if it is a normal behavior, that means social distancing पाळलं नाही, तर one person infects 2.5 people in 5 days and 406 people in 30 days. Whereas if the social distancing is well observed, then one person will infect 0.6% in 5 days and 2.5 people in 30 days. And on the right hand side, you can see the picture. Our India मध्ये social distancing चा तसा पंजा उडालेला आहे. Okay. These are the side effects of the social distancing. Of course, if you do not indulge in the exercise. 14 तारखेक आता 31 तारीख आले, दररोजन बाहेर कसं पडायचे. Then the buttons, then there is one syndrome newly recognized because of the lockdown and excessive eating is maximus diabeticus triglyceridus hypertensus. Of course, this is just for the fun. Physician in the OPD, PPE I will talk a little later, but the physician should perform strict hand hygiene and after patient contact. PPE, everybody knows, I won't go into detail, but I will just shortly go through the government guideline. Who should use the PPE? Now, आता जो तो उठतोय, even the ambulance driver सोडून द्या, ambulance driver सोडून द्या, but everybody, even the गावातले सरपंच, corona quarantine झाल्यापासून सरपंच asking for the give us PPE. ST सुरू झाली, त्याच्यानंतर ड्रायव्हर लोक आणि कंडक्टर लोक मागायला गिव्ह अस पीपी अदरवाइज वी डोंट वर्क. द गव्हर्नमेंट गाईडलाईन्स से दॅट स्पेशली सिंधुदुर्ग मधली ओपीडी प्रॅक्टिस बघितली तर ओपीडी एरिया, देन द रजिस्ट्रेशन काउंटर, वेटिंग एरिया, डॉक्टर्स चेंबर, ह्यामध्ये फक्त N95 मास्क आणि ग्लोव्ज एवढ्याच गोष्टीची गरज आहे आपल्याला. अँड पीपी इज नॉट ॲडवाइज दिस फॉर रुटीन पर्पजेस. Then at tries give suspect patient a triple layer surgical mask. Government advises that if the patient doesn't have the surgical mask, you should provide surgical mask from your own dispensary, or you can charge him, or he should buy from the nearby distant chemist. Then direct the patient to a separate area, an isolation group if available. Of course, the 1 meter distance between the patients should be there even if he is not suspected. Instruct all patients to cover and nose and mouth during coughing, sneezing. Perform hand hygiene after contact with the respiratory secretion. These are some droplet precautions. Use surgical mask working within 1 to 2 meters of the patient. Place patients in the single room or group the COVID and non-COVID. If you have a separate room, you can isolate the or influenza-like symptom patient in separately. Of course, the right at the outside, your receptionist will take the temperature, so no problem. You can very well differentiate them. Use disposable or it's not possible. Instrument that can be used is the gun, but be careful. If anybody comes to you, don't say you are hot, you'll be in trouble. If the foreign country she said thank you, otherwise you will be trouble. Okay, I want to go back just a minute. Yeah. If equipment needs to be shared among the patient, clean and disinfect. Usually the diaphragm of the stethoscope, usually I clean it with the spirit swab or the sodium hypochlorite. Avoid contaminating environmental surfaces that are not directly related to patient care, especially door handles and this thing. Ensure adequate room ventilation. Avoid nebulizer. No nebulizer. In pediatric popular there is a dictum in the corona epidemic that don't use nebulizer. आपल्याकडे मला माहित नाही बाकीकडे सिंधुदुर्गात तर अशी फॅशन आहे की जरा वाफ घ्यायला आलोय, सर्दी असते नुसती नाक खोकला, there is no need to give nebulizer. Even if the patient of bronchiolitis and bronchial asthma comes and really in need of the bronchodilator, you should MDI, meter dose inhaler, that should be used. Even the literature says that the MDI are more powerful or more they're rather better than the nebulizer in the drug delivery system that has been observed. This way again, the laboratory indicators, I won't go into the details because these have been coming to the treatment. Again, I won't go into the details. I will talk on the one or two drugs because anyway, after the diagnosis, we are not going to treat. We are going to send to the COVID center or the government. Chloroquine, hydroxychloroquine, and remdesivir. I don't know whether it is available in India and the cost. These are the drugs. I will skip up just a word about the government guidelines. Regarding the initial care. So the government has specifically mentioned that there is no specific antiviral drug that has been proved effective. And in severe diseases requiring hospitalized management, what is advised is hydroxychloroquine 400 BD on day 1 and 200 milligram BD for next 4 days in combination with the azithromycin. But be careful, do the ECG and look at the QTC interval. It should not be more than 0.45 because physicians will be the better person on regarding this. The above medications is presently not recommended for children less than 12 years and pregnant and lactating women. Then the word about the chemoprophylaxis. ICMR have advised it has recommended hydroxychloroquine for two categories. One is the asymptomatic healthcare patients involved, and they are coming in contact with the suspected or the confirmed cases or the confirmed cases of COVID-19, and asymptomatic household contacts of the laboratory confirmed cases. In these two only, the this thing ICMR has advised. I won't go into the details of this. Word of caution about ibuprofen. Of course, in pediatric we don't use this often. We use paracetamol only. The only thing was Italy, when there was a lot of patients were dying, the ibuprofen was blamed, because in China they were using the paracetamol, and why they were worried about why there is an increase death, there are an increased number of deaths in Italy. So they blame it is because of might be because of ibuprofen, but it has to be put again. Uh, Coming to the last part of the talk, precautions to be taken in the diabetes. The patient should be advised to drink plenty of fluids. If the patient is having trouble or pain in the swallowing, he should have plenty of small sips every 50 minutes throughout. Patients should be advised frequent self-monitoring of the blood glucose to prevent hypoglycemia as well as hyperglycemia. And the specific instructions should be given about the hypoglycemia management. For example, eating 15 grams of honey, jaggery, or keeping a chocolate inside his pocket. And also the drug dosage or the insulin dosage should be adjusted in case the hypoglycemia is there. Patients, particularly type 1 diabetes, are more likely to develop DKA, and the urine ketones should be checked, especially if there is sustained hyperglycemia on two occasions, the random blood sugar more than 250 milligram per DL, then you should check the urine ketones. Ketones are test all small, okay, probably the plenty of fluids and rechecking of the ketones we do. But urine ketones are moderate or large or persistently small, persistently remain small, then they say, or the symptoms of decay, abdominal pain, nausea, vomiting, they should immediately consult the physician. That is very important. Patients should be instructed about the personal hygiene, washing hands, washing fingerstick injuries, etc. Patients with diabetes, particularly those with poor the glycemic control, are at an increased risk of complication, and they should be instructed about the warning symptom and when should they get hospitalized. Very important. Apart from this, patients should be instructed to follow a social isolation. Always to be in touch with your personal doctor in such a situation. I will end my talk with the story of the limping man and the COVID-19. This is a story everybody might be knowing. पाच सहा डॉक्टर्स असतात आणि रोजचं मॉर्निंग वॉक झाल्यानंतर दे सिट ॲट अ प्लेस फॉर अ कप ऑफ टी, आणि लांबून एक माणूस येताना दिसतो, माणूस लंगडत येत असतो, आणि प्रत्येकाला आपली ज्ञान पाजळायची हुकी येते. एक जण ऑर्थोपेडिशियन म्हणतो ही हॅज लेफ्ट नी अर्थरायटिस, मी स्पॉट डायग्नोसिस करतो. दुसरा म्हणतो छे प्रॉब्ली ही हॅज अ लेफ्ट अँकल स्प्रेन. दुसरा एक स्पेशलिस्ट असतो आमच्या रेडकर डॉक्टरांसारखा, तो म्हणतो सी इज लिफ्टिंग हिज लेफ्ट नी अप हायर अप, सो इट इज लोअर मोटर न्यूरॉन लिजन. शेवटी त्यांच्यातलं जनरल प्रॅक्टिशनर असतो, त्याचा प्रॅक्टिकल अप्रोच असतो. तो म्हणतो हे काय नाही, माझं स्पॉट डायग्नोसिस आहे, बघा तुम्हाला जवळ आल्यावर कळेल की त्याचा चपलेचा अंगठा तुटलेला आहे. बाय द टाइम ही टॉक एंड्स, तो पेशंट म्हणण्यापेक्षा लिम्पिंग मॅन जवळ येतो आणि विचारतो तुमच्या जवळ पाणी आहे काय. ते म्हणतात काय काय झालं, कशाला पाहिजे. नाही, माझा पाय जरा शेणात बरबटलाय, मला फक्त पाय धुवायचा आहे. सो दिस इज द thing I want to convey. Let's keep our hopes alive and our attitude positive. Remember, even the darkest clouds have the silver silver lining. This is the photograph of our 1974 batch, Miraz Medical College. And can you identify me? It will be very difficult. On the second row, I am the sixth from the this thing left. I am there, and one of our distinguished speaker or the panelist is also there. Dr. S.V. Kulkarni is my classmate. He is on the top row. Okay, I should not waste time. Thank you very much. If you have any queries, of course, over to Bilal and this thing, Dr. S.V. Kulkarni and Dr. G.T. Rane. We have at one end very much experienced physician, 40 years experience, Dr. S.V. Kulkarni. On the other side, we have the Taza Padpadit, Dr. G.T. Rane. So we'll, hope we'll have a good time. Thank you very much.
Thank you, Dr. Pralhad,
Bilal.
for an impeccable and a very informative presentation on COVID-19 and management of diabetes.